Welcome to the MRCS Bytes session on prostate pathology, OSCE Station 1. Today, we'll dive into this topic and explore the common questions tested during the MRCS Part B exam. For more information and full course, please visit mrcsbytes.com. Question 1. What type of cancer is most common in the prostate? The most common type of prostate cancer is prostate adenocarcinoma. It originates in the glandular cells of the prostate, which produce the prostate fluid that is part of semen. Prostate adenocarcinoma is usually slow-growing, but its aggressiveness can vary. Question 2. From which part of the prostate do cancers most commonly arise from? Prostate cancers most commonly arise from the peripheral zone of the prostate. The peripheral zone is the area located at the back of the prostate and is where the majority of prostate cancers are detected during screenings. Question 3. Name some risk factors for the development of a prostate cancer. Age. The risk increases as men get older, particularly after age 50. Family history. Having a first-degree relative, father or brother, with prostate cancer increases the risk. Genetics. Certain genetic mutations, such as those in the BRCA1 or BRCA2 genes, can increase risk. Ethnicity. Prostate cancer is more common in African American men compared to Caucasian or Asian men. Diet and lifestyle. A diet high in red meat and low in fruits and vegetables may be linked to higher risk. Obesity and lack of physical activity can also be contributing factors. Hormonal factors. Higher levels of testosterone may be associated with an increased risk of prostate cancer. Question 4. What genes are associated with prostate cancer? BRCA1 and BRCA2, HOXB13, ATM, CHEK2. Question 5. What is the normal PSA level in an adult? The normal PSA level can vary, but generally, a PSA level of 4.0 nanograms per milliliter or lower is considered within the normal range for adult men. However, PSA levels can be influenced by various factors, including age, prostate size, and certain medical conditions. Question 6. How is a Gleason score calculated? A Gleason score is calculated based on the microscopic appearance of prostate cancer cells in biopsy samples. Identify the two most common patterns. A pathologist examines the biopsy samples under a microscope and identifies the two most common patterns of cancer cell growth. Each pattern is given a grade from 1 to 5 based on how closely the cancer cells resemble normal prostate cells, with 1 being the most similar and 5 being the least similar. Assign grades. The pathologist assigns a grade to each of these two patterns. Calculate the Gleason score. The two grades are added together to form the Gleason score. For instance, if the primary pattern is grade 3 and the secondary pattern is grade 4, the Gleason score would be 7, 3 plus 4. Interpreting the score. The Gleason score can range from 2 to 10, with higher scores indicating more aggressive cancer. The score helps in assessing the cancer's aggressiveness and planning treatment. For more MRCS Part B resources, please visit mrcsbytes.com.